I'm so happy that we're starting out with laughs. Dr. Sheila Carroll and I are clearly instant friends. She's beautiful. She's brilliant. She is a board certified pediatrician of 20 years experience in Maine. And she's also a pediatric weight loss coach. And so she is here today with me. I'm so grateful to talk about pediatric weight. And welcome, Dr. Sheila Carroll, to the show.
Thank you so much for having me. I'm excited.
Yeah, let's jump right in. We hear all the time in mom circles, in medical circles, that parents are no longer really interested in talking about children's weight as kind of a metric for their health. And so as a practicing pediatrician, I'm so interested to find out how you feel, first of all, how you went from practicing general pediatrics to focusing on weight, like your own story, but also how you feel about parents who come to your office and don't really want to talk about weight. Because it's a touchy subject.
It can be, for sure. Yeah. I started out as a general pediatrician, still am a general pediatrician. And in my office, I see all, well visits and sick visits. And in my spare time, my personal life, I have created a coaching business that's where I really focus on weight and trying to help families, help kids and families together as a unit improve their health, improve their weight if they want to. So here, that's to me is like an important thing, because if you're going to the doctor and you think you're doing fine and you are doing fine, then I think you're doing fine too. I feel that if a family wants to talk about it, I am more than happy to talk about it. And I'm so interested in, there's so many different ways to approach it for individual people that it's such a fascinating topic. If somebody is not interested in weight and that's fine too, then we can shelve that, table that, and move on to other topics that they are interested in talking about in the office. So if a family comes and they're not interested in talking about their child's weight, that is fine with me as well.
How do you approach it though, when you think that there's a medical or metabolic problem associated with weight? Is that a situation where you're kind of more direct about what needs to be done or what needs to be addressed? Or is that something where you're kind of like very gently and sensitively talking indirectly about adding more fruits and vegetables and being more physically active?
I think my usual question is, do you have any concerns, or is there anything you want to talk about with your body, with your weight, with your eating habits? And then I wait and see what they respond to that. If I'm very concerned that there could potentially be a metabolic problem, elevated labs, elevated enzymes, the other trackers that we follow, I will mention that to a family. However, of course, as you know, just from looking at a child, you can't tell if a child is going to have a problem, even if their weight is significantly elevated. If a family's interested in tracking those metrics, we can certainly follow that.
Do you find that when the parent is concerned but the child is not, that there may be a negative kind of emotional impact on the child? Like maybe the kid wasn't thinking about their weight, but now that their parent is concerned, whether it's appropriate or not, that then brings an additional issue to the kid's life. I could see how that could be a challenge for a child who wasn't thinking about their weight. And then all of a sudden, their parents express concern, especially as we're getting into like the middle teenage years where children's body types are changing and maybe a little bit awkward.
For sure. Yes, this is a common problem. And it's important to talk to the family and talk to the parents and find out what their worries are. I like to talk about it with the child and open it up and have it be an open discussion, and in front of the child and with the child present, reassure the parent that the child is perfectly 100%, perfect, honestly, just the way they are right now without changing anything about them. And it's perfectly normal for the parent to be concerned about, their child's health overall.
Yeah.
So, it's kind of like some other behaviors that we might be worried our child was doing. My son for sure is not worried when he spends 4 hours in a row on his video games,
Yeah. Exactly.
although I'm concerned about that behavior. So
Of
I'm
course.
not nervous about talking to him about that I'm going to hurt his feelings or anything like that. So I like to have it as try to make it an open discussion where we can just talk about health in general, and eating habits and activity is certainly part of our health, all coming from the place like, look, you're already 100% perfect and valuable and worthy just as you are right this second. And I'm not trying to change anything to make you different or better.
Yeah.
I'm just trying to keep you as happy and as healthy as possible.
It's so beautiful that you use the word happy, because so even in adult medicine in my world, we place so much emphasis on numbers and diagnoses and metrics and categories and conditions and names, and we leave out so much of the human aspect of health, the emotional, the social, the spiritual. There may be medical problems that are counteracted by the fact that someone is happy, and active. So I think it's beautiful that I just think the world of pediatricians, the way that the capacity that you have to take care of the most important people in our society and in our culture, and speak to them in a language of love and care and concern, the ability that you have to bond with these children and gain their trust. And then in addition, you're making sure that they're healthy and educating them. We're educators at heart, physicians. That's what we want to do. We want to teach people how to be healthy. And when you're doing that for kids, especially for some kids whose family dynamics aren't necessarily the healthiest, to see a professional woman with a warm, caring touch who's brilliant and can communicate ways that a child can be happy and healthy and confident and build self-esteem, that's got to be such a position for a child. That's got to be such an empowering interaction to have, because maybe they don't get that at home, and to hear that from a person that they look up to and trust, I imagine as a child, that's a wonderful thing. I remember I was in 6th grade. We got weighed. We got walked down to the nurse's office and we all got weighed. And afterwards, everybody was talking, and I'm like on the shorter side. I'm like 5'4", and I have been since 6th grade. And I'll never forget, I was 104 pounds. And I was mortified because all the other girls in my class were like 95 pounds and 90 pounds. And of course, everybody was talking about it. And so from 6th grade, that's the very first moment that I can remember, I've been on a diet. I've been worried about what I eat, how I look, and what number I weigh. For a 6th grader, if I feel like I didn't have self-confidence, if I didn't have a reassuring family, healthy family, great support from my parents, that could have gone a really different direction. And I know you kind of have a story from your childhood that kind of made you explore this field as well. So are you willing to share how?
Sure. Yeah, sure. I have struggled with my weight, honestly, since I was even younger than 6th grade. I think the earliest I can remember is when I was 9. Around 9. And I went to the doctor one time. We had this very old-fashioned old guy. And I remember I was sitting there with and I'm one of 5 kids. And I was sitting there and I was the heaviest, I think, of all of our kids. And he goes to my mom, "You got to get her to stop eating." Oh my God. At the time, I don't even really remember how I felt, but I do remember that he gave us a pamphlet that you could fold out that was like the size of a map, and it had the calories of every every food and every fruit. Like I remember an apple, 60 calories, cantaloupe, I don't know, I'm like, and I was only supposed to eat 1,200 calories a day.
Oh my.
I
At
know.
9.
Yeah. And meanwhile, like we have Oreos and that.
I was gonna say he probably gave you a lollipop on the way out, right?
I know. But my siblings who weren't struggling with weight, they weren't trying to follow any kind of diet like this. So, I know my mom really tried to help me, but it just was a challenge. So I struggled since that time. Off and on, and sometimes would be easier than others, but
Isn't it crazy that at 9, and we weren't even exposed to social media, and our comparison was really the kids on our block and in our grade,
yeah,
and
yeah,
how even as early as 9, and especially now, the constant images and the constant comparison that kids are faced with is enough to make you really concerned about their mental well-being with respect to body image and weight. And that's a larger conversation, obviously.
yeah,
But it's, thinking about what that simple interaction did for us at
yeah,
9 and 12,
yeah.
and we didn't have those other external influences, what kids today must be going through.
I know, it's a lot. It's a lot for them.
And you and I talk about, we're talking here, and when we talk about pediatric weight, I think most people will think that we're talking about overweight, and we are generally, but
Yeah.
I know a lot of parents are also concerned about their kids being underweight or being,
Mm.
too thin or not eating enough.
Mhm.
So how
Mhm.
do you kind of approach those concerns?
Well, a little bit in the same way. Are they high, how are they feeling? How's the child feeling? Do they
Yeah.
have good energy? Are they keeping up with their friends? Are they able to run around? And then in a way, what are their eating habits? And what are they eating? And when are they eating? And what's actually really going on? That's potentially leading them to be to be underweight, or it's a difference between being underweight versus just being a lowish kind of normal weight. But it's really exploring eating habits and exploring a lot of the lifestyle factors, sleep, and
Yeah.
um yeah.
And of course, before you start talking about lifestyle stuff as a pediatrician, as a
Mm.
physician, you're looking to make sure that there's not a medical or metabolic problem first, right?
Right. Yes. So that's one reason why we do keep these growth curves, even though they sometimes can be problematic and emotional for people, but they are an amazing tool to spot uh, disease processes, because it's almost never a child would drop off significantly on the growth curve.
Yeah. Yeah. I think that when the kind of concern about using numbers and metrics to
Mm,
measure a child, you beautifully describe how you assess for their happiness and their ability to interact and how comfortable they are, with their body image or their self-confidence or their performance in school. But the importance, just to kind of reiterate, of those metrics and is for us, it's data. It's looking at a
mm,
trend, and we know what the trend should look like. And so when we measure or weigh your child, it's not because we're looking to judge them or say they're overweight or underweight for kicks. It's because we're looking to see if they're falling off the trend. So that's one way of helping us identify if there is a medical or metabolic problem. Because if you see a change, a deviation from that standard curve, we have to go digging, right? We have to go looking for a real problem.
yes, 100%. Yeah. Yeah.
So how do you start to, well, first of all, I think it's great that you see the patients as, you see the children as patients, and you have that relationship. But then you also offer, because that relationship is where you're giving medical advice, therapeutic advice, you are talking about prevention, you're getting them, doing all the primary and secondary prevention that you can. But then from the coaching perspective, which we talk a lot about what coaches, the role of a coach on this podcast, from a coaching perspective, you really are there to provide education, support, and accountability for people who are trying to make some positive changes. So there's a difference, of course, in what your role is when you're wearing a physician hat and when you're wearing a coach hat. If someone comes to you and says, I have concerns about my child and their weight, and I would like for you to coach our family through making positive changes, maybe helping our family or a child in particular, improve control over their weight. How do you start with that process of coaching that child or that family through a weight loss journey?
Sure. So coaching is something, well, I love it, but you have to be willing to be coached. So that's the key. So first of all, sometimes parents come in and say, we'd like some coaching, or we want to please help us. And the child is resistant to that.
Okay.
So, kind of just drop the reins right there. I'm not going to coach a child who's really not interested in that. But I'm certainly happy to coach a parent around those ideas, because that's super important too.
Sure.
And so, in weight loss, especially with like weight loss coaching, there's kind of some action line things, the to-dos, and education provided. And then there's the coaching part of things, which is really looking at our thoughts, the thoughts and the feelings, which are going to drive those actions that you want to do.
Yeah.
And the role of a coach is to actually help the client or help the person see their own thoughts and how their thoughts are generating their feelings, which are driving their actions. So as a coach, you're really a mirror of the person's own thoughts, so that they can look at them kind of, in a way, get a little distance from them, look at them and see, is this thought that I'm having helping me or not helping me?
Yeah.
For example, a common thought, well, parents have a lot of fear about their overweight kids, if we just stick to the overweight part of things.
Right.
And if you have the thought, my child is going to suffer if they remain overweight, that's a painful thought. And the whole goal is not to just thought swap and, oh, let's get you a better thought. Oh, here's a much
Right.
prettier, easier thought. But it really is to look at that thought, and assess, is that thought really true? And is this thought helping you? And if it's not, also look at the other side. Well, what else is true? Maybe, it is true that possibly my child is going to be perfectly fine just the way they are right now. And so it's helping parents just get some insight, awareness about all of the thoughts that are going on around their child, or their own experience of their child.
Yeah. Yeah. So as when you told me that you coach, you're a coach for pediatric weight loss, you have a pediatric weight loss coaching program. I'm thinking to myself, how do you coach child? Because you look at children and they're just, they're either mindful eaters, they just eat and then they stop when they're not hungry anymore.
Yeah.
It's like children are naturally mindful eaters, right? They go by their body cues. They're not necessarily social eaters. They just kind of eat when they're hungry and they stop when they're full. But then as they get older, they can kind of be mindless eaters and just sitting
Totally.
there while they're watching TV or, and so I'm thinking, as an adult, it's difficult to be coached, and so how do you coach children who aren't thinking about their food? They don't have any thoughts about food, or do they? Maybe I'm.
Well, it depends. And you can certainly bring awareness to them, because lots of, like you're saying, lots of kids don't have any awareness. And a lot of kids do overeat, and they've lost, touch with their hunger signals that most, that we're all born with.
Right.
And then at some point lose. Usually, or a lot of people who struggle with overweight lose those ability to tell, when you're actually full and you overeat for other reasons. So talking with a child about that there's lots of different metaphors or ways to talk about it. One way is like choosing foods that are going to be nourishing for your body. Even kids know that, like,
Yeah.
so there's so much here to talk about, but like, I don't like to say that foods are good or bad. So we
Love
don't
that.
want to be like, stay away from these bad foods. I hate to even call foods junk foods, or,
Yeah.
sometimes we call them joy foods, or fuel foods. But
Mhm.
even that, joy is like such a great word. And
Yeah.
it's like, oh, this is a joy food, and this is just a fuel food.
Right. I always say it's just energy. Like, it's not good or bad.
Yeah.
Food is totally neutral. We
Yeah.
make it good or bad, right?
Exactly, exactly. So, depending on the age, but for the littler set, for example, like, oh, when your mom and dad go to the gas station, what are they putting in the car to make it work really, really well?
Yes.
Are they putting in, water? No. Are they putting in Coca-Cola? No. Oh, they're
Love
putting
it.
in gas, because gas is the perfect thing for your car. Just like, whole foods, not processed foods, are the perfect things. We can tolerate a little bit of, other kinds of food, or, not see, it's even hard to even say with words, because everybody knows like the foods that we're talking about, the
Right.
highly processed,
Right.
high sugar foods. And it's fine to eat a little bit of that, and you just have to see how you feel with it, and if you like how you're feeling and the results when you're eating that.
Yeah. I love how when you're talking about coaching children, you are in some cases bringing mindfulness to them, because when they're not aware of what they're eating, and they do tend to overeat or eat the wrong foods, you teaching them or bringing awareness to the foods that will nourish their body best, could that small shift in mentality could be really make all the difference for them. And of course, you're always talking about getting enough exercise and, being outside and, limiting screen time to a reasonable amount of time, because all of those things we know contribute to weight issues, right?
Right. Yeah. And moving your body in a way that feels good, and, for fun, really. And turning down the screen, because it's more fun to be off the screen, and it can, and
Yeah.
really just trying to amp up the real, like, true life pleasures, for a kid, and having them really look for those.
I imagine that it's, as a parent, difficult to ask for help for your children, especially when it comes to weight. And then I imagine that the advice that you give them might be difficult for them to hear or implement, because if the issue with the child's weight is that they have the wrong foods in the house, or that their lifestyle is not as active as a family as they should be, then the problem is not on the kid. The problem is on the family and the parents, really. And so you're doing a lot of adult coaching too, I think.
Yeah, for sure. Yeah. And it is the best, most effective way to change, is to change as a family. I mean, honestly, that's my advice to every single family, even families who aren't struggling with weight, but they're not eating a very fueling diet,
Yeah.
or very fueling foods. I recommend the same thing. Like, start eating healthy as a whole family.
Yeah.
Because we know our kids learn best from watching the parents. They're modeling, they're watching everything the parents are doing. And you don't have to be perfect. That doesn't put any pressure on the parents to be perfect, but it does, how do you want to show up for your child in this way? And here's where the beauty of coaching is, like, okay, once okay, well, I know what we kind of want to be eating. How do we actually implement those changes for ourselves? And what's the mindset shift that I need to make as a mom or dad to buy these foods, or to not buy the foods that we have been buying, or to really plan in advance, sit down ahead of time, make our meal plan, and cook at home, eat as a family. How do we implement these things that we know we should be doing, in quotes, but that sometimes it's hard to actually do?
Yeah.
That's where coaching is like the secret magic of you find out what you're really thinking and why you're not doing that.
Yeah.
And then you can look at that and be like, oh, okay, now, do I want to keep having these, for example, like I say to some kids, if you had the thought, I have to eat this salad because I'm overweight, or whatever your thought is, or I have to eat this, versus I'm choosing to eat this salad because I want the results for my body, or I want my body to feel good. And, just seeing the difference in the empowerment of I'm choosing this versus I have to do this.
Yeah.
And so the minds, and I think the parents can really help the kids once they know that mindset and are able to really see the tool of like the thought, feel, action cycle, and be able to recognize the thought, feel, action cycle that's going on in their child. And that helps explain why the kids are doing what they're doing. And I think it's just so powerful for both a child and a parent to learn that.
How do you feel about strategies like, for example, where parents will say, you can have the snack if you eat all the good stuff first? Is that helpful or harmful? I always wonder, because I've done both. Like, you're just going to eat the salad, or like eat the salad and then you can have the, ice pop or whatever.
Well, I say sometimes like, well, just eating more fruits and vegetables isn't going to help you if you're not kind of changing other things, You can't have, all the things and, throw in some vegetables in there and expect a different result than you're having. This is where every family's individual, and it doesn't have to be so hard, and there can be flux and flexibility, and it doesn't have to be so much rule following. And I think it's possible to create a atmosphere of this is what we generally eat, and we stick to like these general things. And once in a while, we do have an extra, thing here and there that we really want. And I'm not a fan of, you have to eat this and then you can eat this, I wouldn't like that if someone said that to me.
Or like too many rules around it. Kind of having a general positive attitude and educated approach.
Yeah.
Conversation. It sounds like what you're saying, like conversing with the kids about the decisions that you're making so that they can feel empowered. They can feel good about the decisions that they're making. Then maybe they'll allow them to grow and make good decisions for themselves.
Well, that's what we want, because eventually, they're going to be on their own. And even as teenagers, they're making a lot of choices themselves for food and going out with their friends and stuff. We want them to want to eat in a certain way. And we talk about these things very easily. We talk about not smoking, usually with kids, not drinking, usually with, we have no qualms about telling kids that we think that they shouldn't smoke and they shouldn't be drinking and things like that. And if we, not that we say, oh, you shouldn't be eating sugar, you shouldn't be, but if we had a more approach, like, look, let's, for the most part, eat healthy, because we know it's good for us. We know we'll feel better if we do. And also we know that these foods are designed to taste really good. And sometimes we want that too, and we can enjoy that. And then you see and learn to settle out what's right for you. And that's a different spot for every single person and every single family.
Yeah. There's so many things that I'm thinking as you're speaking, just about like the social, like the challenges socially that children and parents face. For example, if I send my child to school with a school lunch that's totally healthy and like it's ideal, it's Pinterest worthy, it's got all the groups, it's got a little healthy fruit snack at the end that's a healthier sweet ending to the meal, and then their classmate brings in a snack that's all garbage, that's all packaged stuff. That that's a signal that sends a message to my child. When they go to school lunch, and school lunch is serving some things that are not the healthiest, this is the school, these are the people who have our best interest in mind. And, maybe that's another signal that can be very confusing to the kids, because at school they have ice cream out, or whatever. There's so many different inputs. And then from an adult parenting perspective, there's so much information. Like, we don't even know how to control our own diets, because we have somebody telling us that the Mediterranean diet is best, and that this weight loss is the diet is the best one to lose the most amount of weight the fastest, or this one's the most sustainable. We don't even know how to eat with a wholesome approach. We definitely don't know how to lose weight. That's obvious. So there's so many societal messages that are mixed for both adults and children, that I imagine that your work can be very challenging. Like, yes, of course, encouraging families to make better choices, but I wonder if the influence of, the world is stronger than the internal strength and willpower to make those choices all the time. Do you see what I'm saying?
I see what you're saying. Yeah, I think the term is obesogenic environment that we live in. Yeah, I just wrote a little blog post about this today.
Yes.
That
sounds about right.
Yeah, did you see that big giant black bear roaming in Tahoe,
Mm-hmm.
Lake Tahoe, and he's eating human food. So eating human food, he's now twice the size of what an average black bear is. So when I saw that, I was kind of like, oh my goodness, he is a victim of this environment that we live in, all of this messaging.
Yeah.
It's you have to make an effort to teach your child. First of all, I think the first thing that we need to do as parents, and I know I needed to do it myself, was I needed to decide on purpose how I wanted to approach this,
Mm-hmm.
and how I wanted to, my expectations for myself as a parent, and really thinking about this, because I have so many other expectations for my son. I expect him to go to school. I expect him to, what, I don't know, 100 different things. Take a shower.
Right. Go to school.
And I can create the expectation that he knows, or at least I teach him how to take care of himself. Mm-hmm. In the big picture of things. And I think it really is available to us to learn, what to eat for our bodies and how that's going to work. Also 100% knowing that there's no one right way.
Yeah.
And it's super individual for every person. And not everyone needs to be, a size, whatever, you can choose to eat on purpose in a way to create whatever result you want for yourself.
Yeah.
And I think it is a very challenging, we are in a very challenging environment. We have a very ancient body. Our body, as our bodies, sometimes with the little kids, I say, who's the oldest person that you can think of? And I get a lot of George Washington or Abraham Lincoln. They're two popular ones. And I'm like, right, okay, let's go back to George Washington. What his body is essentially functioning. He's got the same brain as us, the same heart, the same everything. But look at the food sources that are different to us. I said, George Washington couldn't go, down the street to Cumberland Farms and buy a 32-ounce slushy.
Yeah.
And so we are ancient bodies living in a modern time.
I love that.
And we just need to recognize that and master that and be like, oh, okay, I don't have to eat all the things all the time,
Right.
and just that's what I think is so powerful, like about the education part of how our bodies work and the
Right.
hormonal response to, and it can be really simple. It doesn't have to be so complicated. But knowing that information is powerful, and then you can make the choices that you want.
I think about it from a family perspective, and from my family perspective, my husband and I both work. We have 3 kids, 15, 12, and 7, and who are constantly in and out. We're constantly on the go. Evenings are like the worst time for consistency for us because no day is the same as the previous. And so I think about all the other areas that we try to set examples for them, like drinking alcohol in moderation, not smoking, always wearing our seatbelt. And when it comes to food, it's the most conflicted that I am. I'm clear on all that other stuff, but
Right.
I'm telling them, we need to make great food choices most of the time. We need to cook at home so we know what's in our food. I love to eat in season and local. We get our food and our fresh vegetables from CSA, which is grown in season and locally. And we like to try to do that as much as we can. But I'll tell you, Monday through Wednesday this week, none of us had time to cook it. And so we ate out those 3 nights. So on one hand, I know what I want to do. I try to prepare, you try to be consistent, you try to send them the best message. But then in reality, what they're seeing is that we're too busy to make it work. It's a real struggle. Yeah. And then, I also think about, like, from an equity perspective, everything you're saying is expensive. And I think about, what about children whose parents work 2 jobs and aren't home, and where they don't have the income to purchase, salad. They can purchase a Big Mac, but not a salad, because salads are $5 for a small half container. And so they end up eating out, or they're on assistance programs where they're getting foods that are donated and delivered to their home that might not be the best quality foods. You know what I mean? So that's just another, like, I think our conversation at baseline is talking about people who are in a position to seek out education and to implement them from a cost perspective. It's not all equitable.
Yeah, I agree. It's a huge societal problem, obviously.
Yeah.
Sometimes when I have families that are struggling like that, we do talk about things like, okay, it's fine. You're eating at McDonald's or eating wherever. Then the options are,
Oh my gosh. Yes. I
don't
love
eat
it.
the bun. It sounds simple,
Yeah.
but okay, just eat the meat, eat the
Yes.
things that come in the burger, and don't eat the bun. That at least would, if you're struggling with overweight,
Right.
that at least would, frankly, the bun is not adding to your hunger, adding to your satiation or your feeling of fullness. It's the protein and it's the fat that are creating that. And the bun is just sugar. And so, okay, so fine, go to McDonald's and that, and then, there's just kind of that sometimes we try to strategize on, well, what's the best we can do? What's the next best?
Yes.
What's the next best thing we can do here?
Yes.
And it doesn't have to be perfect. I'm not a person who buys all organic food myself. And frankly, I can't afford that.
Yeah.
And so, I don't think it has to be like that. I think it just has to be understanding the food choices that you're making, and the hormonal response that creates in your body.
So that's so empowering, because what you just said, if I'm hearing you right, is that regardless of what your access to food is, as long as you have access to food, you have the capacity and the to make a choice as to what of those you're going to eat, and you can choose to make the better choice. And if you're educated enough, and if you know enough,
if you know what the better choice is.
Exactly.
Yeah.
That's a beautiful perspective and a way to spin down that even in an unjust system, there are ways to empower you to still take care of your health, which is, I often think about, like, who's listening to this podcast. People who are listening to this podcast are probably people who have the time to listen to a podcast, who have a car to get to work and can listen to it on the way, who are invested in, there's a free podcast, but you have to be invested in your time to learn about how to make changes. And a lot of times the people who need our help the most, and who need the advice, the education, the support, the resources, are the people who don't have the time or the resources to access that. And so, one of the goals always for me is to, like you said, bring options and empower you where you are.
Mhm.
You're not going to tell somebody who has $100 a week budget for food that they're going to go buy everything organic or get meal delivery service, or, you're going to utilize that $100 per week meal budget and you're going to make it as effective and healthy as you possibly can.
Sure. I agree.
I
Yeah.
love it.
I
I love
know.
that.
I know. Yeah. I do think there's lots of choice. There are lots of choices.
Yeah. There's a whole bunch of kind of new certifications. There's culinary medicine, which is a burgeoning field. And it's really,
That's so cool.
it really is. It's essentially making physician teachers and teaching us how to use food as medicine and how changing our diet can not only cure disease, but can improve our quality of life and our longevity. And so, because in medical school and residency, we're minimally taught about nutrition, you probably more so than most specialties. But, the nutrition piece is minimal. And
Right.
so when a physician can learn to teach their patients how to cook, what foods to eat, what approaches to use, like real concepts like frying versus pan searing or baking, or the different types of oils to use, or when to exercise with respect to when you're eating. Those are all things that should be implemented, that we should all have access to know that. And so fields like culinary medicine and other types of trainings for educators and physicians and other experts who are trying to improve the health of the people in their community they're on the rise. And I think they're a tremendously valuable addition to our curriculum.
I agree. And I think physicians are really jumping into that wholeheartedly too, for prevention of disease in addition to treatment.
Yeah. What part of your approach when it comes to coaching involves, or I shouldn't say coaching, when it comes to treating a patient, like what I would guess I could rephrase that and say, what percentage of your patients do you think have like a metabolic or medical condition that requires like medication for weight control?
We tend to, I would say I refer those patients. There's a specialty clinic and where I live, a weight and wellness clinic that tends to handle all the medications. We try to go at it from a lifestyle perspective for at least a little while at first. But I guess I don't know. I would say a very small amount of my patients are on medication.
Yeah.
For weight. Something like metformin would be something that some kids are on.
Yeah. So that kind of gives you an idea of the incidence of, medical obesity and how the treatment options, the incidence of people or children who are really truly needing medical therapy is small. And
Exactly.
that most obesity in children and most children who are underweight, like, don't need medications. They need lifestyle changes.
Right. Yeah, for sure. 100%. Yep. I agree. Yeah. The vast majority of pediatric overweight, at least that I see, could be remedied by lifestyle changes. Yeah.
And the lifestyle changes are the same in adults as they are in babies. They need sleep. They need adequate sleep, because that is where our hormones and our chemicals are created that control our hunger and satiety. That's where all of the damage that we do to our bodies during the day is repaired. That's where our memories are compacted. That's where everything refreshes and regenerates. And if you're not getting good, high quality sleep, then none of that is happening. And then also when you're tired, you're not making better choices. Your mood is lower. You're quicker to opt for something that requires less work.
And your food choices are worse. Yes. We know that the hormonal, the brain chemistry is actually like signaling your brain to choose these foods.
Right. So sleep for sure is one. physical activity, which we know correlates, can you remind me what the recommendation is for kids now in terms of the number of minutes that they need to exercise?
I think, we use that 5-2-1-0. Have you heard of that? 5 fruits and vegetables a day, limit your screen time to 2 hours a day, 1 hour of physical activity a day, and 0 sugary drinks, 0 juice or soda, that kind of thing. So that always helps me remember that. So I guess it's about 1 hour,
so let's put sugary drinks in the category of cigarettes and alcohol, right?
Yeah.
It's 0. It should be none.
Yeah. Yeah.
I like that. 5-2-1-0, 5 servings of fruits and vegetables, 2 hours of less than 2 hours of screen time, 1 hour of physical activity, and 0 sugary beverages.
Right.
Beautiful.
Yeah.
Sleep, diet, exercise, stress management, which is a huge lifestyle thing, especially now in kids. I mean,
right.
We're seeing all kinds of increases in incidence of depression and anxiety and suicide in children related to all kinds of social issues. And so teaching children how to manage their stress can make them better eaters.
Yeah.
Social connectedness.
Teaching parents how to help their children manage their stress.
Teaching parents
teaching parents how to manage their own stress so that they can model how to manage stress for their kids.
I have to tell you, Sheila, my 7-year-old comes home from school and I will see her sitting, and I was so grateful to be in the school district that we're in. It's a public school district, and she comes home with her fingers on her lap, and when she's feeling overwhelmed, she's meditating.
Oh, wow.
They have conflict resolution sessions where they're modeling how to resolve arguments with loved ones or friends. They have self-esteem and anti-bullying posters all over the school. They have programs where no child sits alone at lunch. And in fact, friend groups aren't even necessarily encouraged to sit at the same table. They mix up the tables on purpose so that no kid ever feels like, these kinds of things socially can mean the difference between life and death for a child, for someone who's struggling with anxiety, depression, bullying, body image issues. So I think that the trend is, or that we're headed towards improving mental health in our children in our schools. And I'm always impressed when she comes home and she just starts self-soothing. She just starts meditating. I'm like, what the hell? Like, I don't even know how to do that.
It's wonderful. My son has something called social emotional learning, SEL. And of course he's like, oh, we have SEL, he not his favorite, but he comes home but he is listening to everything that they say. And it's giving him a 10-year-old boy. He has a language to talk about his thoughts and his feelings. So I just think that is so powerful for kids too.
Yeah.
And, lots of kids have anxiety. I see a ton of anxiety in my office.
Yeah.
Where kids not really understanding that they're not their thoughts, that they're, and that they're feeling like they're anxious instead of the fact that they're having a worry thought.
Yeah.
So trying to, and parents not knowing what to do with that because of the fear of like, oh my gosh, my child. And it is panic inducing sometimes. But yeah, all of this stuff is so powerful to the education of trying to help people understand what they're going through, and then they can help their children through what their children are going to go through.
Yeah.
Because we know our children, we want their lives to be pain-free, but they won't be no matter what we do.
Yeah.
But what I sometimes say is like, well, let's try to take out the optional suffering part of things. Let's put on yourself. Yeah, exactly. We know we can't make our child's life 100% pain-free, but we can help them not add on suffering to themselves that they don't need to.
Yeah. Yeah. The world has felt really heavy in the last couple of years. Our kids are watching us struggle. And, I've seen not just because we're back in the office now, seeing patients in person, I see an overall increase in the number of people who are adults who are seeking help, who are saying, the pandemic has helped me to realize all of the things that I don't know how to do and that I don't cope well with. And I didn't address it before. I didn't have time or bandwidth to address it during the pandemic. And so now I feel like people are kind of coming out of the woodwork because in the last 2 years, they've learned about themselves a lot. They've learned about what they can handle and can't handle, and that they may or may not have the appropriate coping strategies to deal with difficult things, minor or major. And so I'm seeing a lot of people coming and asking for help now that things are kind of calming down, that we're back in person, and that people are really starting to reinvest in themselves. And so
I mean, that's amazing. Good for them.
Yeah,
good job.
Awesome. I know. And I worry about how all of that looks to the kids. I say the answer for the cure for the future is in the children. I really believe, as I see my children and their friends interact, and I see what's going on in the world in their age group, they're the ones who are going to save the planet. They're the ones who are going to do all of the beautiful things. They're going to change the way that we interact with each other and we love each other. I just believe in them so much. And I know you do too.
Yeah, for sure.
But I'm all about sharing free resources because I love to improve access to free health information. That's why I'm here. And I know that you share some free resources in addition to your pediatric practice in Maine and your coaching services that you offer. I know that you have some free resources. So please, before you go, Dr. Sheila Carroll, let my friends who are listening know where they can find you online and in person so that they can continue to learn from you and work with you.
Well, first of all, thank you for having me. And this podcast is an amazing resource for everyone. I love it. I love the work you're doing. My free resource right now is, I have a blog on my website, which is www.sheilacarroll, SHEILACARROLLMD.com. And on that, you could also download, it's called the Starter Guide to Pediatric Weight Loss. Okay. So it's a PDF, I forget, 10 pages, something like that, where I tried to concisely put together like a brief, simple explanation about hormones that I feel like are really crucial to understand. There's a lot of good sleep advice because I loved everything you said about sleep. I mean, it is the most underrated tool for health that we have.
Agreed.
What else? It has Eat as a Family. It has lots of good advice to try to, or to get you started down the road if you are looking at like, well, what could I do to possibly consider changing, or what would be the most effective thing to change? So you can easily go to that and get that for free.
And as a suggestion for the future, you probably already thought about it, but I know that there are families out there who would appreciate some similar free information about their children who are underweight, and maybe some strategies to help those children along as well.
That's great advice. I'll work on that.
Yeah. Like you need more to do, but I feel like we could talk for hours.
I know.
I feel like I could think of 10 other topics that we could create podcast episodes out of. And so I hope that you will agree to be a guest on my show again in the future. Thank you.
I would love to.
For being a bright light in this world and for doing all the wonderful work that you're doing. It has been my pleasure to speak with you today.
Thank you so much.
Bye.
Thank you. Bye.